Welcome to everybody. This meeting is of the opioid trust. It's been duly advertised as a public meeting in accordance with the Sunshine Act and is therefore open to members of the public as observers. Participation in the meeting is limited to the trustees, representatives from their offices, and guests from the trust advisors and partners. I would note that any representative who's standing in for a trustee does not count toward a quorum. This meeting is being duly recorded, and the video will be available on the trust website along with minutes from the meeting after they are approved. There was an executive session held immediately prior to this public meeting for the purposes of receiving legal updates and legal advice. And that was done. Could you call the roll, please, so we can confirm that there's a quorum of the trustees?
Yes. Tumar Alexander,
Good morning, everyone present.
Commissioner Kevin Boozle,
Present.
Aaron Dalton,
Present.
Secretary Latika Davis Jones,
Present.
Commissioner Jean DiGirolamo,
Present.
Steve Jasper, Shay Madden,
Present.
Commissioner Robert Postal, Senator Greg Rothman, Representative Mark Rozzi, Representative Jim Struzzi,
I'm here.
Senator Christine Tartaglione,
Here.
Chair Tom Van Kirk.
Here.
I'm gonna try Rob Postal again.
Yeah. I'm gonna try one more time, Commissioner Robert Postal.
The reason we're rechecking is because he was in the executive.
Yeah, and he should be back on. I think he hadn't let me know ahead of time that he was gonna hop off, but he'll be back on.
Yeah, I believe that they had their public meeting of their
Yeah.
their county commissioners, so that's the reason he wasn't. And I would say that Senator Rothman is attending a funeral of a very close friend and was unable to attend, and that's the reason for that that he is not attending. There's a quorum present for the meeting, so we can go ahead and get started. There was sent to you before the meeting the minutes of the October 29th, 2024 public meeting. Could I have a motion for the approval of those minutes?
Motion.
Okay, second,
Second.
all in favor, please say aye.
Aye.
Opposed? Okay, motion passes. The minutes are approved. Lisa Ritter, could you please give us an overview of the trust financial statements through October 31st, 2024? These were also sent out to all of you before the meeting.
Good morning. If you could pull up your copy of the financial statements, Bree, will that show on the screen?
No.
No, that's
I do not
fine.
have that,
That's
no.
fine. They were prepared in your materials, so you have a copy of them. It's the income statement for October, the end of October. Couple initial comments. Your financial statements are on the cash basis. So it gets recorded when we pay, write a check. When money is deposited to the trust, that's when we record income. So keep that in mind as we look at these financial statements. I gave you a little bit more detail this time because there's information over the course of several months that we need to talk about. But the first line is your Wilmington Trust investment income, and you'll see that it's $3,486,000. That is based on our current Wilmington Trust bank balance of $324,379,000. So that interest income will remain that high on a monthly basis, 1.2, 1.3 million for 2 more months. Then in December, we'll make the large distribution. So then after that, I would expect the interest income to drop significantly from where it is now. But 2 more months of this trend is what I would expect. M&T Bank interest income is shown there. That's a smaller balance, 335,000 to pay administrative types of expenses. If you could look in the March column, and this is why you've got multiple columns, There's a deposit there, and it's got a footnote attached to it. It's a deposit for $21,055,000. And if you look at footnote 3, this was a prepayment for Socorro related to payment year 7 that we're not gonna pay out until we get to that year 7. So that money will be remaining in the account going into next year.
And that, by the way, we are withholding it, but it is, that was a motion that was made at a public meeting and was voted on, and we agreed that we were gonna withhold that until year 7.
This will be the first time that we saw it last month. So the wave 2 money is included in here, but you see more months, so you can see the detail. But in the October 31st, 2024 column, there's a deposit or receipt there from Endo, which will not be distributed in December. So both of those deposits will remain going into 2025. So our total receipts or income on the cash basis is $318,654,819. The bottom portion of this are expenses. Wilmington Trust fees only bills us annually, so that's why you don't see a fee there. I'm expecting a bill from them in December for their annual fees. You see the M&T fees. Legal expenses are broken down. RTK, right to know law types of legal work is separated from general counsel type of work as it has been. There are no payments showing to the Commonwealth of Pennsylvania because we paid their payment last year in December. This year, that'll get paid in June, and you'll see that in the 2025 financial statements that get presented. Same for the fee fund. You'll see there's insurance expense, accounting expense, and there's a footnote on administration expense. That's CCAP. They haven't billed yet for a portion of 2024. That bill, that's an estimate here of 150, is probably closer to 160. We'll pay it when those bills are submitted. There's one more item for expenses in the administrative category. Penn State has a contract to provide services. They have the website, the reporting tool. They have not submitted any bills to date. So I gave you an estimate of $200,000 as a portion of their $540,000 contract. I don't know if those are the expenses, but wanted to give you an indication that there's a bill that's coming, and I expect it to be approximately that amount, but I haven't seen it, so I don't know for sure how much in expense they've incurred to date. But as soon as we get it, those expenses will be paid. So your operating or administrative expenses for the year, there's no distributions included in this yet, $783,402.
And we do have representatives of Penn State here, and I would urge you to please get your billing.
Have urged somebody just this morning to do that.
Somebody from your law school will tell you the importance of getting bills in.
Fully concur. I would just say if you do need, I can get you, if you want to check that estimate. I can get that for you if that's appropriate offline.
Sure, thank you.
Anything else, Lisa?
No, unless there are questions.
Okay. Any questions of Lisa about the financials? I would note that the investment income, as we had agreed, that we earn, it does go toward administrative expenses. Any administrative expenses that have been incurred by the trust since its formation in July of 2022 to present have been paid out of investment income. None of it has come out of the corpus of the distributions from any of the settlements, although we are authorized to do so. And I anticipate for at least the next 3, 4, 5 years that the investment income that we have already earned and that will be earned in the future will cover all of the administrative expenses of the trust. Once again, thank you very much to all the trustees who serve without pay, which is part of the reason we're able to use solely investment income to cover the administrative expenses. Then I'd like to move on to the insurance renewal. Before you do that, excuse me.
just on the investments, do we know the percentages that are being paid by Wilmington still? You know that?
I can look that up here. I'll get.
I don't need it online. I'm just want to keep it in our head because I think that they're gonna start trickling down too.
They are gonna trickle down, there's no doubt about it.
I didn't know what our contract was written for.
And they have been, I believe, around the 5% number, but I do believe we can expect it to be trickling down.
Just like to forecast a little.
Okay, we'd like to move on to the next agenda item, which is the insurance. At a public meeting last year, we approved a resolution to obtain insurance coverage for the trust from Henderson Brothers, which is a Pittsburgh broker. The insurance policy presented for approval included directors and officers, D&O policy, as well as technology errors and omissions coverage. The insurance policy is required by our contract with CCAP, which we'll be discussing later on in the meeting. But also it's just good practice to make sure that that we have the insurance, particularly with the so many cases being brought with technology issues. The coverage is as I said, is a requirement. The primary coverage is with Fair American, which is an AM Best AA superior rated insurance company. The policy discussed is set to expire currently on December 1st, 2024. And what we're asking for in the documents that were submitted to you is to obtain a renewal for the board's review, and that has been circulated. I would note that it is at the same price as last year, so there has been no increase in that, nor have we changed the amount of the coverage. So with that, I would like to ask if I could set this up for discussion, that I have a resolution to the effect that resolved based upon the insurance renewal documents included in the materials distributed to the members of the Board of Trustees for this meeting. The board hereby accepts the primary $5 million coverage as presented. The trust administrator, the County Commissioners Association of Pennsylvania, working with the chair, is authorized to execute any forms necessary to execute and finalize such coverage. Could I have a motion to that effect, please?
So moved, Kevin Boozle.
Second?
Second, Shay Madden.
Thank you, Shane. Discussion. Hearing none, all in favor of the motion, please say aye.
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 Opposed? Hearing none, motion passes. Thank you very much. Next, we have had a request for an extension from Lackawanna County for an extension of time for which for them to make use of the money that was paid out in 2022. You might recall that we had the court order gives everybody 18 months, so that the 18 months for Lackawanna and every other county would have expired on June 30th of 2024 for the monies that were paid out in 2022. We did agree at a prior board meeting, as a matter of fact, the meeting of September 7th, 2023, recognizing that everybody had to plan for the expenditure of the funds. We did grant an automatic 6-month extension for funds received in wave 1 payments 1 and 2, which were paid out, of course, in September and December of 2022. Then we did pass a resolution in May of this year that would permit recipients of the trust funds to request further extensions of the applicable expenditure deadlines if necessary, which would be reviewed by the board on a case-by-case basis. Lackawanna County is the only county that has requested an extension, but they did request an extension on November 14th, 2024. And reported in connection with that it is currently working with community and government partners to collaborate on a large-scale project, but they need to have time to finalize that and put it in good order. We did tell them that we would bring it up at this meeting. And I would like to, I do recommend that we grant the extension request. And I would like to ask for the following motion: resolve that Lackawanna County's extension request for an additional 6-month extension to expend funds received in 2022 is approved. Lackawanna County shall now spend or commit all such trust funds by June 30th, 2025, unless a further extension is requested and granted by the trust. Could I have a motion to that effect, please?
I'll make that motion.
Thank you,
Gene?
Gene.
I'll second.
Okay, any discussion of the motion? All those in favor, please say aye.
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 Opposed? Okay, motion passes. Thank you very much. Okay, moving on to what will be the largest portion of this meeting, will be to, as we have in prior meetings, to address the expenditures that were made by counties and have been reported. You'll recall that at the public meeting in February of 2024, we did approve the resolution to require each county to submit a report to the board by September 15th, showing the actual expenditure of trust funds and the amount of trust funds received but not spent from January 1, 2024 through June 30th, 2024. The reports that we were dealing with in earlier public meetings were all based upon reports that were submitted to Penn State on March 15th. And we did think it was appropriate to put in, because of the volume that we were dealing with, the additional reporting period. So that we did ask everybody to report on expenditures by September 15th. That did fall on a Sunday this year, and therefore we modified the due date for the reporting to September 16th. On or about September 16th, all 67 counties did submit reports to the trust detailing the expenditure or commitment of the trust funds on specific programs determined by the recipient to be compliant with Exhibit E for our review. Working groups met during the period of October to November to review the September 16th reports submitted by the trust recipients, consistent with prior practice. Each program was characterized by the working groups, which are now going to be presented, as either recommended for approval, still under consideration, or non-compliant. The board will review those working group recommendations. Following today's public meeting and the actions of the board, each county will receive a follow-up communication from the trust detailing the programs that have been approved as compliant with Exhibit E to the settlement agreements or disapproved as non-compliant. This follow-up communication likely will go out after the Thanksgiving holiday, just to give people a chance to put together exactly what is going to be in those reports and digest everything that was discussed in this meeting. There are two categories of the programs that I believe will warrant further clarification before we start discussing them. First, in the September 16th report, some counties included programs that were reported in March and previously approved by the trust at public meetings earlier this year. Since these programs were already approved as compliant with Exhibit E, they do not appear in the working group recommendations at this meeting. I would note that the working groups did look at certain of the county's programs that had been previously approved where there were large increases of expenditures that might have been made, just to see if it would change their opinion as to the prior program, but we do have none of those to report. Secondly, the counties, some counties, on September 16th did include descriptions of programs, but did not identify that any funds were either spent or committed on those programs during the reporting period. After confirming with each county that no trust funds were spent or committed during the reporting period, these programs should not have been reported and will appear, and the counties were so advised, and will not appear in the working group recommendations since no action was taken on those programs. The working groups reviewed those programs and are encouraged by what they saw, look forward to reviewing them in the next reporting cycle, and did find, by the way, that had monies been expended on those, most of them would have been recommended for approval at this meeting, but they are not going to be approved since there was no dollar amount. So with that, if you could put up on the screen, 3. We will review the programs that were submitted and the recommendations of the working groups. The spreadsheet has been displayed. The programs are identified by county name, program number, program name, dollars reported as spent or committed, and the working group's recommendation. I would say in the past, we gave the same report, whether we are recommending approval or not, in order that counties will better understand why programs may be deemed to be disapproved or non-compliant. We are going to give a fuller explanation of those programs in this as part of the recommendations, and I do appreciate the working group leaders working to compile that additional information. So with that, we can start with Allegheny County, which was part of working group number 3.
Okay, that is me. So you want me to talk about the total spent and committed both? In all of these?
Yes, please.
Okay.
If you
Okay, so Allegheny program number 15, Allegheny County Department of Human Services, community-based interventions at the Jade Wellness Center. Total spent is $11,603.63. Total committed is $107,255.37, and we recommended approval. Allegheny County program
Oh, by
number
the way-
16.
By the way,
Oh,
after the
sorry.
presentation on each individual one, if there are questions that people have, please ask them at that time. We will have a vote later on. You can also ask further questions then, but it would be helpful if when the program is presented and either recommended for approval or not, that we have a whatever detailed discussion people want to have at that time. Sorry, Jay, you can go on to Allegheny 16.
Okay. Allegheny County program number 16, is it Auberlay? Not sure if I'm saying that right. Family Healing Center. Total spent is $200,000. Total committed at this point is nothing further, and we recommended approval. Questions? Allegheny program number 17, BioBot Analytics Inc. wastewater testing. Total spent was $7,890. Total committed was $17,110. And we have this still under consideration. Allegheny County program number 18, Allegheny County Department of Human Services, community-based interventions at Your House. Nothing spent at this point, $160,000. Total committed, recommended approval. Allegheny County program number 19, Allegheny County Department of Human Services, community-based interventions, the Hugh Lane Wellness Foundation. Nothing spent, Total committed, $104,261.75. Recommended approval. Allegheny County Program number 20, Allegheny County Department of Human Services, Community-Based Interventions, Sisters Place, Inc. Total spent is $3,237. Total committed is $71,763. We recommend approval. Allegheny County Program number 21, Allegheny County Department of Human Services for Community-Based Interventions at Sojourner House. Total spent is $18,631 with a total commitment of $149,369. We recommend approval. Allegheny County Program number 22, Allegheny County Department of Human Services, Community-Based Interventions, Three Rivers Youth. Nothing spent. Total committed, $238,986. We recommend approval. And Allegheny Program number 23, Allegheny County Department of Human Services, Community-Based Interventions at the Women's Center and Shelter. Total spent is $18,010.61, and the total committed is $54,589.39, and we would recommend approval.
Thank you. Anything further, or does anybody have any further questions on Allegheny County? Okay, moving on to Beaver County. Shay, I believe this is also yours.
Yep. Beaver County Program number 8, Freedom Healthcare Services, LLC, doing business as Clear Choices. Clear Choices Certified Recovery Specialist Program. I've spent $45,574.18 with a total commitment of $316,120.06, and we recommend approval. Beaver County Program number 9, Beaver County Single County Authority, treatment services for Beaver County residents, including MAT. Total spent is $60,285.62 with a total commitment of $139,714.38. We would recommend approval.
Okay. Any questions? Okay, we'll move on to Bedford County, and that is working group number 2, Aaron.
Sorry about that. I'm here. So Bedford County, yep, Bedford County, the Bedford County Jail is the applicant. It's medication assisted treatment for incarcerated individuals. The amount spent is about $24,000, and committed, total committed is still under consideration, and we recommend that for approval. Moving on to the next Bedford one, number 3, Bedford County Jail, propelling individuals to recovery. The amount committed is $47,981 and spent, none spent yet, and we would recommend this for approval.
Okay, any questions concerning Bedford County? Moving on to Berks County, program number their program number 30, and this is back to you, Shay.
Berks County Program number 30, creating lasting family connections. Total spent is $22,030.82 with a total commitment of $24,969.18, and we would recommend approval.
Okay, any questions on Berks? Moving on to Blair County, and that was working group number 1, Kevin Boozle.
Blair County, project number 3, County Medical Assisted Treatment Program. Amount spent is $18,001.83. The set aside is $1,625.62. It is recommended for approval.
Any questions? Okay, I would like to, as in the past, we are going to break this into counties for purposes, approving working group recommendations. I would like to just point out, there's a lot of recommended approvals here, as there will be for the rest of this. I'd like to think that a lot of this is because we had said at the very beginning, there was going to be a learning process. There was going to be a learning process in what could be spent, what is permissible under Exhibit E. It's a learning process for both the trustees. It's a learning process for the counties. I do think that as evidenced by the number of programs that have been recommended, it isn't because the trust is becoming more lenient or making bigger exceptions for Exhibit E. I do think everybody has been learning from this process, and I expect this will continue going on in the future. I hope all counties in the future, and you'll hear more about this when we talk about the CCAP proposal later on in the day, but I do hope that counties will be learning from each other, see programs that have been approved, and indeed learning what it can be used for. And we also intend going forward in the future to present some programs that might have been done in other states so that we can expend the whole body of knowledge as far as what works and what doesn't work. And I know Penn State, Temple, and Pitt are working on that and trying to come up with so that they can say, here are things that really work and are very valuable. And but I did want to point that out before the resolution. With that, I'd like to ask for a resolution that resolve the Board of Trustees of the Trust, based on the recommendations of the working groups that met and reviewed the follow-up reports from counties, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E, described and incorporated into July 12, 2022 order of the Commonwealth Court that created the trust. Allegheny County programs number 15 and 16, and Allegheny programs 18 to 23. Beaver County programs 8 to 9. Bedford County programs 1 and 2. Berks County program number 30. Blair County program number 2. Can I have a motion to that effect?
I'll make a motion with a correction. I believe it's Blair project number 3, not number 2. Is that correct? I'll make that motion with number 3.
Okay, I will accept that amendment and have made that note. Thank you. And with that, you've moved it with.
Yes, I did.
Okay, is there a second to the motion?
I'll second. This is postal.
Okay, thank you. Any discussion of the motion? All in favor, please say aye.
Aye.
Opposed? Abstentions? Thank you. Okay, let's move on to Bucks County, and that was working group number 3. Shay, you're back on.
Bucks County Program number 37, County of Bucks Human Services, Public Defender Social Worker, $23,592.09 spent with a commitment of $73,407.91. We recommend approval. Bucks County Program number 38, the County of Bucks Human Services, Bucks County Emergency Shelter, $1,262.17 spent with a total commitment of $53,737.83. We recommend approval. Bucks County Program number 39, Bucks County Drug and Alcohol Commission, Peer Support and Case Management, $2,150.49 spent with a total commitment of $197,849.51. We would recommend approval. Bucks County Program number 40, Bucks County Drug and Alcohol Commission, Prevention Programs, $6,675 spent with a total commitment of $118,325. We would recommend approval. Bucks County Program number 42, County of Bucks Human Services, 24/7 Crisis Stabilization Unit, nothing spent at this time, $883,600 committed. We would recommend approval.
Thank you. Any questions concerning any of the programs under Bucks County? Hearing none, we'll move on to Butler County, and Shay, this is also you.
Butler County Program number 5, Center for Community Resources, a housing coordinator. Amount spent is $29,489.14 with a commitment of $40,774.86. We would recommend approval. Butler County Program number 6, Center for Community Resources, Reintegration Apartment. Amount spent $5,036.36. Is that right? And the commitment is $4,963.64. We would recommend approval.
Okay, any questions about Butler County?
I have 2 more.
Oh, I'm
Sorry.
sorry.
Butler County Program number 7, Nonprofit Development Corporation Recovery Center. Amount spent is $166,430.48. And total committed is $171,569.52. We would recommend approval. Butler County Program number 8 at the Butler County Prison, MX 908 with Letty program. Total spent is $65,950.68. And I believe that is still under consideration.
Questions concerning Butler County? If I could, before we move this page, I would like to go back to, because it's an example of the working of the Dispute Resolution Committee, also the Bucks County Program number 42, which was the Crisis Stabilization Unit for $883,600, is one that it is the second tranche of a payment to the Bucks County Stabilization Unit. The first tranche, in the amount of $900,000, was initially not approved by the trustees at, I believe, the June meeting. It was appealed to the Dispute Resolution Committee, and the Dispute Resolution Committee did in fact approve it and said that it was a proper expenditure of under Exhibit E. And now this one, as it came up for the second tranche, which we were forewarned, by the way, there was going to be several tranches of this, but it is recommended for approval, as you see. But I did, for anybody that remembered the back to when the first tranche wasn't approved, I just wanted to point that out. Okay, let's move on to Cambria County Working Group number 2, Aaron.
Yep, thank you. Cambria County, project number 2, this is the county prison for medication assisted treatment. Amount spent is $35,584. Total committed still in progress, none right now, and we're recommending this for approval. Want me to move along to the next one? That's Cameron County.
Yes, please.
Okay, this is project number 4, alcohol and drug abuse services. This is a recovery hub. Nothing spent to date with 35,000 committed, and this is still under consideration.
Moving on to Carbon County, Kevin.
Thank you, Chairman. This is Carbon's number 2 project for Carbon Monroe Pike Drug and Alcohol. They have $14,613.01 spent, $11,386.99 committed. Drug and alcohol counseling services, it is recommended for approval.
Any questions? Moving on to Chester County, Aaron.
Yep. Chester County, project number 14, Gateway Horseworks, the equestrian recovery supports. They've spent $7,740 and committed nothing additional. And this is recommended for approval. Project number 34, the Chester County SCA. Yeah.
Aaron, if I could on the
Yeah.
on the Chester 14. This was one that we had disapproved originally. This entire group, it was appealed to the Dispute Resolution Committee. Dispute Resolution Committee upheld that original decision, but also did point out that if they made some tweaks to what they were submitting, primarily in this case, identifying exactly what portion of their expenditure went to OUD disorder and what part of this treatment, this recovery treatment really was spent on opioid as opposed to the numerous other things that were covered in the equestrian recovery program. They did come back with a percentage, and that was reviewed by the working group, and it was viewed to be, it could be said that we should have waited and done this when it was re-reported in next March 15th. We just don't see the reason for making a county wait after it's gone through the other process and when it was reviewed by the Dispute Resolution Committee. They were invited to come back. The working group concurred with that, and that is the reason that that is on this agenda as opposed to waiting until next March 15th. Okay, Aaron, if you could move on to Chester 34.
Yep. Yep, thank you. Chester County Project number 34. This is the SCA and it's for medical community education. $1,790 spent, $1,255 committed, and we recommend for approval. I'll keep going to Chester Project number 35, Philadelphia Area Psychodrama Institute. This is professional education for addiction professionals. 4,800 spent, nothing additional committed, and we recommend for approval. Moving along to project number 36. This is the Chester County SCA. This is addiction professional workforce development. So a bunch of training initiatives and education initiatives here. $7,127 spent, 3,287 committed, and we recommend for approval. Moving on to project number 37. This is also the Chester County SCA. Prevention alternative activities. It's a post-prom mini grant project with $29,999 spent, and this is still under consideration. Moving along to project number 38, also the Chester County SCA. This is the drug take back program with $1,190 spent, and we recommend for approval. Chester County number 39, the Carson Foundation. This is prevention and evidence-informed education with nothing spent but 20,000 committed, and we recommend for approval. And I think that might be it for me for a second.
Okay, any questions about anything under Chester County? Once again, if we could, this is a good break point to have another resolution so that we don't have to take them all at one time. So I would like to ask for a resolution that resolved that the Board of Trustees of the Trust, based on the recommendations of the working groups that met and reviewed the follow-up reports from counties, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E, described and incorporated into the July 12th, 2022 order of the Commonwealth Court that created the trust. Bucks County programs number 37 to 40 and Bucks County 42. Butler County programs 5 to 7. Cambria County program number 2. Carbon County program number 2. Chester County programs 14, 34 to 36, and 38 to 39. Could I have a motion to that effect, please?
I'll move the motion. It's postal.
Thank you, Bob. Anything else? Anybody, could I have a second to it?
Second, this is Aaron.
Thank you. Any discussion? All those in favor, please say aye.
Aye.
Any opposed? Any abstentions?
Kevin Boozle for Butler.
Kevin Boozle abstained as to Butler.
But otherwise.
Otherwise, I'm good.
And I'm sorry, I said aye, and I do not have a vote unless there's a tie, so I retract my aye.
And Chairman Van Kirk, if probably appropriate for me to go back and abstain from Allegheny. I missed that. So just if we could, I don't know that you have to reintroduce a motion and so on, but I should probably abstain for Allegheny.
We will correct the record on that, Aaron. Thank
Okay,
you.
Thank you.
Okay, moving on to Crawford County, and that was Shay, back to you.
Crawford County Program Number 1 with Prime Care Medical, Inc., MAT at the correctional facility. Nothing spent, $135,000 committed. We would recommend approval. Crawford County Program Number 2, Crawford County, PA, Narcan dispensers for public areas. Nothing spent, $500,000 committed. We would recommend approval. Crawford County Program Number 3, Star Marketing Group for marketing outreach. Nothing spent, $75,000 committed. We would recommend approval.
Okay, any discussion of the three programs under Crawford County? Okay, moving on to Cumberland County, and that was working group number 2, Aaron.
You're muted, Aaron.
Thank you. This is Cumberland County Project Number 2, Perry Drug and Alcohol Commission. It's a Narcan distribution program. $14,385 spent, $39,348 committed, and we would recommend approval. Cumberland Project Number 3, this is also the Perry Drug and Alcohol Commission. This is OUD treatment, $14,990 spent, and $9.07 is committed. We would recommend approval. Cumberland County Project Number 4, still Perry Drug and Alcohol Commission. This is for evidence-based prevention with $36,678 spent and $34,830 committed, and we would recommend approval here as well. I'll wait for a little scroll down on the screen. Thank you. And I guess that's it for Cumberland. Any questions about Cumberland before I think I continue with Delaware?
There's 2 more with Cumberland.
Oh, I'm sorry. It's just the screen messed me up there. Okay, Cumberland Project Number 5. Folks agree that's where we're at?
Yes.
Okay, thank you. Perry Drug and Alcohol Commission, Student Assistance Early Intervention Program with $39,000 spent and $46,000 committed. This one is still under consideration. And I think lastly for Cumberland, Project Number 6, this is Cumberland County Criminal Justice Services, Cumberland Problem Solving Courts with $244,566 spent and $291,711 committed, and we would recommend approval here.
Okay, any questions concerning Cumberland County? Okay, we'll move on to Delaware County. Once again, Aaron.
Yep. Delaware County Project Number 23. This is the American Treatment Network, and it's a community recovery center with nothing spent to date but $550,000 committed, and we would recommend approval. Project Number 24 for Delaware County. This is the Amistad Law Project. And it's a similar kind of, but different audience, community recovery center, different target audience, with $23,677 spent and $76,323 committed, and we would recommend approval here as well. Delaware County Project Number 25. This is the MVP Recovery Program, which is community recovery centers in the community, I think they're CRSs, I'll just say, in emergency rooms with nothing spent and $504,747 committed, and we would recommend approval here. And Delaware County's Project Number 26. This is the Opioid Crisis Action Network, a recovery stabilization crisis action network being proposed here with $70,184 spent and $429,815 committed, and we would recommend approval here as well. All right, let's see, Delaware. We do have a couple more. We're on 27, is that right?
Yes.
Okay. Project Number 27 for Delaware County Emergency Services. This is chest compression equipment with nothing spent but 175,513 committed. And this is still under consideration. And project 28, International Center for Alleviation of Poverty, immigrant opioid prevention education with nothing spent and 56,254 committed. This too is still under consideration. Couple more for Delaware County. We're up to project number 29. This is the Maternity Care Coalition with wraparound and recovery stabilization in the maternity system with nothing spent and 100,000 committed, and this is recommended for approval. Number 30 for Delaware County Mental Health Partnerships. This is peer support services with nothing spent and 300,000 committed, and we'd recommend approval here as well. Project number 31, St. Joe's University. This is implementation of substance use prevention with nothing spent but 500,000 committed, and we'd recommend approval. And Delaware County project number 32, Savage Sisters Recovery, prevention education with nothing spent and $68,550 committed. We'd recommend for approval here as well.
I believe there's one more.
One more for Delaware County. Project number 33, this is the Shevlin Family Foundation. It's a family recovery community center with nothing spent and 550,000 allocated or committed rather, and this is still under consideration by the committee and the trust.
Questions concerning Delaware County? Okay, moving on to Elk County, and that was working group number 3. Shay.
Elk County Program number 4, Alcohol and Drug Abuse Services, Elk, Cameron, McKean Counties, support transportation MAT. Amount spent is $163.75. We would recommend approval. Elk County Program number 5, Elk County Probation Department, OUD client housing in the amount of $2,635, which was spent, and we would recommend approval. Elk County Program number 6 at the Elk County Prison, Elk County Prison Harm Reduction Strategy. Total spent is $34,300 with nothing more committed. That is still under consideration. Elk County Program number 7 at the Elk County Prison, OUD Service Connection. Amount spent $40,602.34 with nothing further committed. We would recommend approval.
Okay, any questions concerning Elk County? Moving on to Erie County, working group number 2, Shay.
This one's me. Yep. Erie County project number 11, Gardenzia Inc. This is for Erie County Certified Recovery Specialists with 112,500 spent and nothing additional committed, and we recommend for approval, right?
Yes.
Yep. Okay. Yep. Just to note, in the spreadsheet it says recommended compliant, but I don't know that matters. But the committee has recommended that for approval.
And this is the second one. I had mentioned Chester County and its equine program. This was another one that initially it was not approved by the trust. It was taken to the Dispute Resolution Committee, which upheld that determination, but did note that the program itself was good. It just, if it was tweaked from the standpoint of pointing out exactly what part of the monies was being spent on opioid use disorder as opposed to other programs, that we would reconsider it. They did get the information back to us. The working group had re-reviewed this and is now recommending approval. But I did want the trustees to know that we originally had said no, the Dispute Resolution Committee concurred, but they did make the tweaks that the Dispute Resolution Committee suggested. And once again, we didn't think that, we thought it was appropriate to approve it now as opposed to making them wait until March 1st. Okay, moving on to Franklin County.
That's me too.
Yep.
Yep. Franklin County project number 2. Pennsylvania Recovery Organizations Alliance. This is certified recovery specialists and family recovery specialists with nothing spent and 9,000 committed, and we recommend for approval.
Questions concerning Franklin? Hearing none, I'd like to ask for the following resolution. Resolved that the Board of Trustees of the Trust, based on the recommendations of the working groups that met and reviewed the follow-up reports from counties, hereby approve the following programs as compliant with the applicable settlement terms as set forth in Exhibit E, described and incorporated into the July 12, 2022 order of the Commonwealth Court that created the trust. Crawford County programs number 1 to 3, Cumberland County programs.
I'm sorry.
Okay, I got you.
Sorry.
Sorry. I mean, you're supposed to be helping me, not
Testing. Keep going.
Delaware County program 23 to 26 and 29 to 32. Oak County programs number 4 to 5 and number 7. Erie County program number 11 and Franklin County program number 2. Could I have a motion to that effect?
So moved. This is Erin.
Thank you.
Second it, two more.
Thank you, Mark. Appreciate it. Any discussion? All those in favor, please say aye.
Aye.
Any opposed? Any abstentions? Okay, we will move on to Indiana County, and that is working group number 1, Kevin.
Thank you, Mr. Chair. Indiana County project number 2, Armstrong, Indiana Clarion Drug and Alcohol. They have expended $3,924.73. No committed. We did recommend for approval. Indiana project number 3, the Bridge House Recovery Housing, $2,799 was spent. No other committed. Also recommended for approval. Indiana project number 4, Armstrong, Indiana Clarion Drug and Alcohol again. EMS intervention, $69 expended and no dollars committed at this time, and it is also recommended for approval.
And this was recommended for approval. We did note the amount of $69 for it, and we are seeking additional information as to whether or not they intended to put more to be committed, et cetera. And we can deal with that. So, but it just seemed odd to us that they were seeking approval for something that was just $69, and we did want to know if it was more of a continuing program, but we are recommending the approval of exactly what they asked for. Any questions for Indiana County? Okay, moving on to Lancaster County, Aaron.
Yep, thanks. This is Lancaster, project number 7, County Drug and Alcohol Commission Recovery House Scholarships. And this is there's nothing spent to date, but 125,000 committed, and this is recommended for approval. Next is Lancaster project number 8, Drug and Alcohol Commission, Donegal Substance Abuse Alliance. This is reentry recovery support specialists with $1,751 spent and 81,800 committed, and we're recommending this for approval as well. And Lancaster project number 9, County Drug and Alcohol Commission. This is drug and alcohol staffing for a project manager for the settlement work with nothing spent to date and 35,000 committed, and we've recommended this for approval.
Okay, any questions for Lancaster County? Moving on to Lawrence County, and that is Shay.
Lawrence County program number 9, Lawrence County Recovery Coalition for Lawrence County Recovery Coalition Community Awareness. Amount spent was $20,000. Total amount committed, $20,000. We would recommend approval. Lawrence County program number 10, Game Changer Youth Program, Youth Prevention Program. Spent $20,000. Total committed, $20,000. Still under consideration. Lawrence County program number 11, Lawrence County Medical Society, the Lawrence County Medical Society Community Action Planning Conference. Amount spent was $40,000, nothing else committed, recommend approval.
Okay, any discussion of Lawrence County? Moving on to Lehigh County, and we're back to you, Kevin.
Thank you. Lehigh project number 5, family coaching. And they spent $21,152. They have $100,000 committed, and it is recommended for approval. In addition, project number 6, again, Lehigh County advertising support, $16,027. Spent $78,594 committed. This is also recommended for approval. Lehigh project 7. Change on Hamilton Center, $31,898.21 expended, $260,000 set aside, and it is also recommended for approval. Lehigh's project number 8 is discharge specialist, $25,395.94 expended, $200,000 set aside, and it is also recommended for approval.
Questions concerning Lehigh County? Hearing none, we will move on to Luzerne County, and that is working group number 2, Aaron.
Yep, Luzerne County project number 2. These are both Luzerne, Wyoming counties, SCA. This first one is for prevention programs with nothing spent but $208,468 committed, and that's recommended for approval. Then project number 3, this is again their SCA. It's an expansion of warm handoff programs and recovery services with nothing spent and $208,468 committed, and we've recommended this for approval as well.
Okay, any questions concerning Luzerne? Move on to Mercer, and Aaron, this is also you.
Yep. So Mercer County project number 12, primary health network. This is mobile opioid and health outreach clinic support, and they've spent $56,970 to date with nothing additional committed, and we recommend approval here. Mercer County project number 13, Ray of Hope. They've spent $50,430 to date with nothing additional committed. And it's Ray of Hope, but Ray of Hope is a recovery house. And we've recommended approval here as well.
Okay. Any questions about Mercer? Okay, moving on to Monroe County, Shay.
Muted.
Shay, I think you're muted.
Sorry, I was doing so well. Monroe County program number 3, Kudu Creative, Kudu Letty program. The amount spent was $27,875. Nothing further committed. Recommended approval. Monroe County program number 4, American Program Bureau Inc., Public School and Community Events. Total spent $40,000. Total committed $40,000. Recommend approval. Monroe County program number 5, Carbon Monroe Pike Drug and Alcohol Commission, their SCA, CMP treatment and counseling program. Total spent $75,000. Nothing further committed. Recommend approval. Monroe County program number 6, miscellaneous promotion programs in the amount of $160 was spent. Committed was $5,075.50. We would recommend approval. And Monroe County program number 7, recovery programs, nothing spent, $850 committed. Recommend approval.
Okay, any questions concerning Monroe? Okay, hearing none, we will have a resolution. Resolved that the Board of Trustees of the Trust, based on the recommendations of the working groups that met and reviewed the follow-up reports from counties, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E, described and incorporated into the July 12, 2022 order of the Commonwealth Court that created the trust. Indiana County Program number 2 to 4, Lancaster County Program numbers 9 and 11, Lawrence County Program 8 to 9, Lehigh County Programs 5 to 8, Luzerne County Programs number 2 to 3, Mercer County Programs 12 and 13, Monroe County Programs 3 to 7. Could I have a motion to that effect, please?
One correction. It's Lancaster County Programs 7 and 9, Lawrence County Programs 9 and 11. Sorry.
Okay,
I'll make that motion with that correction.
okay.
Kevin.
I'll
Okay,
second Shay.
A motion to, as amended by Jason. Any questions concerning the motion? Hearing none, all in favor, please say aye.
Aye.
Opposed? Any abstentions? And I would point out, Representative Struzal, that, because I think this might be your first meeting where we're actually voting on some of the programs. I know Indiana County is your program, but it is only the county commissioners that we ask to abstain from their counties. And we do not ask you to abstain from merely because you are a representative representing one of the counties that made the presentation. So
Okay.
I want to point that out, okay?
Thank you. Yes.
Okay. It's 11:45. I personally am ready for a break. If you don't mind, let's take a 10-minute break. I would point out, is there lunch out there now? Yeah. For those in the room, we are going to also grab some lunch during this. So let's reconvene at noontime, which will be about 15 minutes from now. And if everybody would get back on the phone, then we will move on with the rest of the agenda. Thank you. Okay, as Bree reminded me, I'm 30 seconds late. We will get started with Northampton County. And number 1, Kevin.
You mean. Northampton, project number 8, Bethlehem Health Bureau Overdose Fatality Review Team. They've expended $19,825.02 and $19,825.02 committed. And that was recommended for approval. Northampton's project number 9, Northampton's SCA Mobile Outreach Vehicle in the amount of $112,856.54. The same number was set aside for that. It was also recommended for approval. That was it for Northampton.
Okay, any questions concerning Northampton? Yeah, we could move on to Perry County, and that would be you, Aaron.
Thanks. Perry County, project number 2, Cumberland, Perry Drug and Alcohol Commission, Narcan distribution program with $2,683 spent and $20,085 committed, and that's recommended for approval. Project number 3, again, Cumberland Perry Drug and Alcohol Commission. This is OUD treatment with $19,228 spent and no additional committed, recommended for approval. Project number 4, same Cumberland Perry Drug and Alcohol Commission. This is evidence-based prevention and early intervention services with $29,593 spent and no additional committed, and we're recommending for approval there.
Okay, thank you. And as you would note from Aaron's presentation, Cumberland and Perry are part of the same Drug and Alcohol Commission, and to the extent that some of the programs sound familiar, it's because we already dealt with it in connection with Cumberland County, and we made consistent recommendations. Any questions concerning Perry? Hearing none, we will move on to Philadelphia. Kevin.
Thank you. Shay and Aaron, you can sit back. I got 2.5 pages, so go ahead and eat your lunch. Philadelphia, project number 73, Scattergood Foundation, had a total expenditure of $3,116,818, set aside of $3,500,000, and it was recommended for approval. No, it was not recommended. Sorry, I didn't have it there. We do not have that information at this time. Is it so under? I can't remember what that one was.
So that's, Commissioner, that is listed as sort of the overarching program. It has not been reported as a program unto itself. The grants, the individual grants that fall under that. We're still trying to work through that with Philadelphia County.
Thank you.
Yeah, we are seeking a clarification from Philadelphia, much as they did when they reported on March 15th, and that we discussed and addressed at the May 20th and the June meetings. Scattergood came under one total $3.5 million. It was broken into a number of individual grants. We did deal with them, and we are also going to deal with them here under individual grants. Still to be discussed. We have yet to get a clarification as to what the overall administrative expenses are. We do not know how much of the 3.5 million that's reported under Scattergood actually went to grants and how much of it is going to Scattergood for whatever they do. So just, we are not dealing with any approvals for payments to Scattergood under than the individual grants that they had broken out.
Yeah, this one does get confusing because we did break it apart, so I appreciate that. Thank you for the clarification. Philadelphia, project 74, Black Muslim Men United, $100,000 expended, no other set aside. It's still under consideration. Philadelphia 75, Women in Dialogue. It is 20,000 expended, no other set aside, still under consideration. Philadelphia 76, Paid Kids. It is $100,000 expended, no other set aside, and it is still under consideration as well. Philadelphia 77, Connectedly, $20,000 expended, no other set aside, recommended non-compliant for this program. Project number 78, Face to Face.
Kevin, if you don't mind.
Sure.
Because there were a fair number that were recommended as non-compliant. We did try to put notes in on the spreadsheet. If we could get into the detail of why we, why the recommendation was made by the working group to recommend non-compliant.
Thank you, Tom. This was on project number 77. The rationale for recommended non-compliance is insufficient information to establish a demonstrated connection to OUD and does not appear sufficient related to OUD treatment. We had a lot of discussion about several of these programs, but that seemed to be a theme. Philadelphia number 78, which is Face to Face, 100,000 expended, no other set aside. It is also recommended non-compliant. Similar issue, as I said, insufficient information to establish demonstrated connection to OUD and does not appear sufficiently related to OUD treatment or prevention. Philadelphia number 79, Hope Incorporated, the project Hope, 100,000 expended, no other set aside, still under consideration. Philadelphia number 80, Hunting Park Green. Hunting Park Green has expended 100,000, no other set aside. This is recommended for non-compliant, again, due to insufficient information to establish the demonstrated connection to OUD and does not appear sufficiently related to OUD prevention. Philadelphia number 81 interim house, 100,000 expended, no other set aside. We recommended for approval. Philadelphia number 82, you are the key, 20,000 expended, no other set aside, still under consideration. Philadelphia 83, Uplift Center for Grieving Children, 100,000 expended, no other set aside, still under consideration. Philadelphia 84, Reawakening Agency, 100,000 expended, no other set aside, still under consideration. Philadelphia, the Lighthouse, 100,000 expended, no other set aside. It is recommended for approval. Philadelphia number 86, Everywhere Project, $20,000 and was expended, no other set aside. It is still under consideration. Philadelphia, the Educational Advocate, reaching today's hardworking students, 100,000 expended, no other set aside. We did recommend non-compliant. Insufficient information to establish demonstrated connection to OUD does not appear sufficiently related to the OUD prevention. Philadelphia 88, Ordinary Heroes, 100,000 expended, no other set aside. It is still under consideration. Philadelphia number 89, the African American Male Wellness Agency, 100,000 expended, no other set aside, still under consideration. Philadelphia number 90, Team Incorporated, 20,000 expended, no other set aside, and it is recommended non-compliant. Similar result, insufficient information to establish demonstrated connection to OUD and does not appear sufficiently related to the OUD treatment. Philadelphia number 91, St. Mark's Church, Frankfurt, $20,000 expended, no other set aside. St. Mark's Church is recommended for approval. Philadelphia number 92, South Philly Punks with Lunch, $100,000 expended, no other set aside. It is not recommended for compliance. So recommended for non-compliant.
I'm sorry, tomorrow, you have your hand raised.
Yeah, Chairman, thank you. I just wanted to ask if we could put the spreadsheet back up on the screen for us, please.
Yes, we're getting up now. The computer that had the spreadsheet decided that it wanted to restart in the middle of this.
Thank you,
So,
Bree. Thank you.
right now.
We'll pause until.
Yeah.
It's up now?
Yeah. You just need to scroll down to, Kevin, what number were you on?
892, sorry.
Billy 92, please, Alexis.
Tamar, do you want to go through them slowly so you can take a look at it, or?
No, I'm good. I was following along with a separate document, but I know it was kind of hard, so I'm good now. You can just continue. Thank you.
Thank you.
I'll start back over on 92. Philadelphia 92, South Philly Punks with Lunch, 100,000 expended, no other set aside. It is recommended non-compliant. Again, insufficient information to establish demonstrated connection to OUD and does not appear sufficiently related to OUD prevention. Philadelphia 93, Beyond the Bars, $10,000 expended, no other set aside. It is recommended non-compliant. Again, insufficient information to establish demonstrated connection to OUD and does not appear sufficiently related to OUD treatment. Philly 94, Bicycle Coalition of Greater Philly, $10,000. It is recommended non-compliant, insufficient information, again, to connect to OUD and does not appear sufficiently related to OUD prevention. Philly 95, Big Picture Philly, Big Picture Philadelphia, 10,000 was expended, no other set aside. Recommended non-compliant, again, insufficient information to connect to OUD and does not appear sufficiently related to OUD treatment. Philly 96, Education Plus Health, also known as the program KCRF. $10,000 spent, no other set aside. It is recommended non-compliant, insufficient information to demonstrate connection to OUD and does not appear sufficiently related to OUD prevention. Philly 97, Friends of Harrogate Park, 10,000 was expended, no set aside, and recommended non-compliant. Insufficient information established again for OUD and does not appear sufficiently related to OUD prevention. Philadelphia 98, Hope Partnership for Education, 10,000 expended, no other set aside. This is recommended non-compliant, insufficient information to connect to OUD and does not appear sufficiently related to OUD prevention. Philadelphia 99, Inglesia International, yeah. And come on, Christine, if you can help me out here. NA or Spanish was not my thing. I took French. $10,000 expended, no other set aside. Recommended for non-compliance, insufficient information to establish a connection to OUD and does not appear sufficiently related to OUD prevention. Philadelphia 100, Clean Kensington.
Commissioner.
Yes.
Hang on a second.
Can you give us a minute? Sorry, this computer is having a hard time.
Okay. We'll pause there on number 100.
God bless you. I got the,
Office is updating a bit randomly.
we got the Microsoft blue screen of death, so. All right. Exit that.
Alright, I'm back up.
Or
So,
Philly 100. Close out.
We are on 100. Still good? Okay. Philadelphia 100, Clean Kensington, $10,000 expended, no other set aside, recommended non-compliant, insufficient information to establish the connection to OUD and does not appear sufficiently related to OUD prevention. Philadelphia 101, Philly Bridge and John, PBJ, $10,000 expended. No other set aside. It is recommended non-compliant, insufficient information established to connect to OUD and does not appear sufficiently related to OUD prevention. Excuse me. Philadelphia 102, Servant Partners, $10,000 expended, no other set aside. Recommended non-compliant, insufficient information to connect to OUD and does not appear sufficiently related to OUD treatment. Philadelphia 103, Simple Homes Fuller Center, $10,000 expended, no other set aside. Recommended non-compliant due to insufficient information to establish demonstrated connection to OUD and does not appear sufficiently related to OUD prevention. Philadelphia number 104, Students Run Philly Style, $10,000 expended, no set aside. Recommended non-compliant, insufficient information established to connect to OUD and does not appear sufficiently related to OUD prevention. Philadelphia 101, or excuse me, Philadelphia 105, Team Hayes, $10,000 expended, no other set aside, recommended for non-compliance due to insufficient information to establish demonstrated connection to OUD and does not appear sufficiently related to OUD prevention. Philadelphia 106, Uplift Center for Grieving Children, $10,000 expended, no other set aside. This is recommended non-compliant due to insufficient information to establish demonstrated connection to OUD, does not appear sufficiently related to OUD treatment. Philadelphia Musicopia, $100,000 expended, no other set aside. This is also recommended non-compliant. Insufficient information to establish demonstrated connection to OUD and does not appear sufficiently related to OUD prevention. Philadelphia number 108, Trash Academy. $10,000 expended, no other set aside, recommended for non-compliant. Insufficient information to establish a demonstrated connection to OUD and does not appear sufficiently related to OUD prevention. Philadelphia number 109, Operation Save Our City. $20,000 expended, no other set aside. This is still under consideration. Philadelphia number 110, Show Me the Way Foundation. $20,000 expended, no other set aside. This is recommended non-compliant due to insufficient information to establish demonstrated connection to OUD and does not appear sufficiently related to OUD treatment. Philadelphia number 111, New View Institute. $100,000 expended, no other set aside. This is recommended for approval. Philadelphia North Philly Project. $100,000 expended, no other set aside. Recommended for approval. Philadelphia number 113, Northwest Community Court Program. $20,000 expended. This is still under consideration. Philadelphia number 114, Philadelphia Community Land Trust. $20,000 expended, no other set aside. And this is recommended for non-compliant, insufficient information to establish a demonstrated connection to OUD. Philadelphia number 115, Philly House. $100,000 expended, no other set aside. It is recommended for approval. Philadelphia number 116, RAH Civic Association. $100,000 expended, no other set aside. This is still under consideration. That concludes our notes for Philadelphia.
Okay, discussion of anything under Philadelphia?
I have a general question, just as you all know, I'm not on that work group, but was there an information request made to the county and then Philly didn't respond back? Is that where a lot of this insufficient information is coming from, or designation is coming from?
Yeah, Philly was given the opportunity to amend their report to include information on the Scattergood contract, and they did not choose to do so.
But I think what Tamar was asking was specific programs that might have been deemed to be non-compliant.
Yeah, I think it was both, Tom, but that's helpful. That's helpful. That Bree's response was also helpful, because I was under the impression that that information was provided. So that's helpful.
Tamar, I will tell you that working with Jason and Bree, I know that they have reached out. We've tried to work with Philly to get more information on these programs. I know it's a lot of things that were recommended as non-compliant. But just as an example, we've begged them to give us further information. Most of these proposals don't even mention the words opioid or drugs. They are just open and totally open-ended. And frankly, without being overly critical, if it is being let to Scattergood to make the recommendation to give these grants, I would highly recommend that Philadelphia ask Scattergood as part of their obligations to work with these people who are getting the grants to provide the necessary information. So.
Yeah, thank you, Chairman. I do. I received, I guess, an email just a few seconds ago. Looked like it was an email dated October 22nd to the trust and some other folks CC'd. So we figure out how to discuss that, I guess, moving forward in the appeals process with Philly. But they seem to intimate that this email was in response to an additional information request.
Okay. Any other questions about Philadelphia?
Yeah, Mr. Chairman, this is Postal. Turning to number 114. That was determined to be non-compliant. And I'm familiar with land trusts and a little bit about housing. I'm wondering if that should be still under consideration. I see the words continue advocacy and education on racial and housing justice. Now, that's a stretch, but I also see the phrase maintain houses for people in Northfield with experiences of addiction and recovery. And so my question would be to detail a little more the experiences of addiction and recovery, and therefore should it be under consideration or non-compliant? I'm sure it's going to be appealed anyway, but I just wondering if the work group questioned that.
We did, Mr. Postal, and the responses were mixed. I think that they weren't tracking the percentage of what would OUD look like. You can't consider an entire census block under this umbrella of OUD, and I think that was the issue. And they had no plans of tracking the that portion of it. So that was our largest issue, I think.
Would you, as head of the working group, Kevin, would you recommend, and I think, Robbie, you're also on that working group, would you accept his recommendation to move 113 to, 114 from recommended non-compliant to still under consideration, to give them still another chance to provide information?
Well, actually, I'm not in that working group, Mr. Chairman. I'm in a.
Sorry, I thought you were.
No, yeah, the first time I was. So I could empathize with Kevin.
I think as you'd mentioned, they have the opportunity for an appeal, and I'm open to that. I think that's the process.
Okay.
So
Maybe we should,
Yes, leave the,
sorry.
go ahead, Erin.
Yeah,
Sorry.
no, maybe we should just make a note on process here, just for folks who may not be aware, just the way we break down work. And so like, I have no opinion about any of the Philadelphia proposals because I wasn't part of that work group. And so, when we're assenting to the motions that will come forward, it's based on the work group's work. And that's true of work group 2. Others haven't participated in that part of the process.
No, I'll accept this postal again. I mean, that's fine. I'll accept the work group's conclusion. I just asked the question, and I'm sure it'll come up again. Thank you.
Thank you.
Okay, other discussion of Philadelphia? Okay, hearing none, we will vote on or have a resolution with respect to Northampton, Perry, and Philadelphia. Resolved that the Board of Trustees of the Trust, based on the recommendations of the working groups that met and reviewed the follow-up reports from counties, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E, described and incorporated into the July 20th, 2022 order of the Commonwealth Court that created the trust. Northampton County Program number 8 and 9, Perry County Programs number 2 to 4, Philadelphia Programs numbers 81, 85, 91, 111, and 112, and 115. Could I have a motion to that effect?
So moved, postal.
I'll second. Kristen.
Okay. And
Second.
any discussion of the motion? All in favor, please say aye.
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 Opposed? Any abstentions? Okay, and we do have a further resolution because there were some that were viewed as non-compliant. And that resolution is further resolved that the Board of Trustees of the Trust, based on the recommendations of the working group, hereby disapproves the following programs as non-compliant with the applicable settlement terms as set forth in Exhibit E. Philadelphia County Programs 77 and 78, Philadelphia Program 80, 87, 90, 92 to 108, and 110 and 114. Could I have a motion to that effect?
I'll make the motion, Kevin Dozel.
Second?
One second.
Thank you, Senator.
Hmm.
Any discussion? All those in favor of the motion, please say aye.
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 Chairman, I'd like to be noted abstainer,
I'm
Abstain.
sorry, noted as,
abstaining to it.
okay, thank you.
Thank you.
Any nays? Motion passes. We will move on now to Pike County, please.
Okay. Off mute, right? Okay, Pike County Program number 3 with the Pike County District Attorney's Office. Pre-arraignment treatment to health program, Justice Opioid Resource Coordinator. Amount spent $7,062.22. We recommended approval. That's it for Pike. On to Potter.
Yes.
Potter County Program number 8, Potter County Human Services, Treatment Services. Amount spent $27,992.78 with $25,000 committed, and we recommended approval.
Thank you. Any discussion of Potter? Moving on to Snyder, Aaron?
Yes, Snyder County, proposal number 2, Susquehanna Valley Mediation Families in Recovery Program with $104,283 spent and no additional committed, and we're recommending for approval.
Okay. Moving on to any questions about Snyder? Moving on to Somerset County, that is back to you, Shay.
Somerset County Program number 9, Somerset County Children and Youth Services, lock boxes and Narcan. Amount spent $500, nothing further committed. We recommended approval. Somerset County Program number 10, Beal Counseling and Consulting for BCC Jail Services. The amount of $40,000 was spent, nothing further committed. We recommended approval. Somerset County Program number 11, Children's Aid Home Programs. $20,000 spent, nothing further committed, recommended approval. Somerset County Program number 12, Open Roads to Recovery. Amount spent is $3,000, nothing further committed. We recommended approval. Somerset County Program number 13, Berlin Brothers Valley School District, Berlin Schools alcohol, tobacco, and other drugs. Amount spent $5,000, nothing further committed. We recommend approval. Somerset County Program number 14, Twin Lakes Center, an overdose awareness event. Amount of $1,500 has been spent, nothing further committed. We recommend approval. Somerset County Program number 15, Twin Lakes Center, 24 hours, 24/7, I think that's supposed to be access line, $6,000 spent, nothing further committed. Recommend approval. And Somerset County Program number 16, the Somerset County Single County Authority, Jail Case Management, $11,210 spent, nothing further committed. We recommend approval.
Thank you. Questions concerning Somerset County? Hearing none, we'll move on to Susquehanna County, and that is Aaron.
Sorry, unmute. Susquehanna County, project number 2, Endless Mountains Health Systems. To date, spent $35,000 with $35,000 committed, and we've recommended for approval. Susquehanna County project number 3, Treehab, with $5,000 spent and $5,000 committed. We've recommended for approval. And number 4, Susquehanna County Interfaith, $10,000 spent and $10,000 committed, and we've recommended for approval.
Okay. Discussion of Susquehanna. We will move on to Union, Kevin.
Thank you. Union project number 1, Families in Recovery, $103,690.92 expended, no other set aside. It is recommended for approval.
I would like to use this one to point out some of the value of the various meetings that take place across the state that the trust has been offered to get involved with CCAP. I believe Union at one of the CCAP meetings in Hershey. Kevin, myself, Rob Postal, we're all making a presentation just concerning Exhibit E, concerning how the trust was operating. We asked the counties what questions they had and what programs they were instituting. Union used this as an example of something they were using, and it was far different from what other counties had been doing so far, which was to expand the families of those that and really work with them to welcome recovering addicts back to the family. And it was a very, very valuable conversation and just an example of how conversations and presentations and other things and working among the counties can really result in very good programs and people learning from each other. So I did want to point that out with regard to Union County.
I think they're looking to do more of those as well with CCAP, so we're looking forward to that as these reports come out.
Yes. And I think we'll deal with that with the proposal that's going to be made by CCAP. Okay, with that, I would like to ask for a resolution. Resolve the Board of Trustees of the Pennsylvania of the Trust, based on the recommendations of the working groups that met and reviewed the follow-up reports from counties, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E, described and incorporated into the July 12th, 2022 order of the Commonwealth Court that created the trust. Pike County Program number 3, Potter County Program number 8, Snyder County Program number 2, Somerset County Programs 9 to 16, Somerset County Program 2 to 4, Union County Program number 1. Can I have a motion to that effect, please?
I'll make the motion with an addressing an issue. It was Susquehanna County programs 2 to 4.
I'm sorry.
That's also twice.
I'm sorry. I apologize.
No problem.
Been a long day so far.
I understand.
Sorry about that. Accepting that as a modification to the motion. Is there a second?
Second Postal.
Here. Any discussion? All those in favor, please say aye.
Aye.
Opposed?
Aye.
Opposed? Any abstention? Okay, motion passes. We will now move on to Venango County, and that is Kevin.
Sure is. I'm sleeping over here, but sorry. Venango County, project number 2, warm handoffs. No expenditures, but $125,400 has been set aside. It is recommended for approval.
Okay. Discussion of Venango. Okay, Warren County, Aaron.
Warren County, project number 1. It's an opioid misuse and addiction program with $41,473 spent, and that same amount committed for future, and this one is still under consideration.
Okay. Wayne County, Shay.
Muted.
Shay, you're muted.
Hurry. Wayne County Program number 2 with the Commissioners and the Single County Authority for a female sober living house. Nothing spent, $600,000 committed. We would recommend approval.
You. And Wayne County, number that will be, excuse me, Westmoreland County, and that is back to you, Kevin.
Thank you. Project number, I do have a question back on the other one, just because it had no action, but
No.
Yeah, so Wayne County, we had been reaching out to them about their numbers and they came back with us with their amended report for the committed. But that was after we had sent your material, so that was the
No,
change.
not a problem. I just wanted to see, make sure I didn't miss something there. Thank you. Westmoreland, number 12, Lower Borough, Police Department, under the DARE School Resource Officer SRO program, $62,832.96. Expended, no other set aside. The recommendation is for non-compliant, insufficient information to establish a demonstrated connection to OUD. Westmoreland County, number 13, project, the Hill Group, gap analysis, 26,000 expended, 14,000 committed, and this is still under consideration.
Any questions concerning Westmoreland? Last but not least, we will move on to, no, it's not last. I don't know my alphabet very well. Wyoming County, Kevin. again.
Wyoming County, project number 2, Wyoming County Human Services, $72,000, 54 cents, or excuse me, $72,054.63 has been committed, no expended, and it is recommended for approval. Wyoming County, project number 3, media campaign, public education campaign, no expenditures, 100,000 committed. It is still under consideration.
You. Okay, and that will bring us to York, which is the last county to be discussed, and that is Aaron.
Yep, thank you. York County, project number 13. This is SCPA Works, and it's a recovery-friendly workplaces program with 115,000 spent and nothing additional committed, recommended for approval. York, project 14, Equiteam Support Services. This is equine support therapy with $66,792 committed, or I'm sorry, spent and nothing additional committed. That's recommended for approval. York, I lost that. You guys, I can do it from my screen. If you're all right with it.
Hang on.
Hold on 1 minute, Aaron.
Okay. Darn, I was gonna get it done.
Sorry, guys, this computer really doesn't like us. Can I have the flash drive? I'm gonna have to switch to this computer.
Do you want me to continue or do you want me to wait? I have it in front of me, but
I think you can go ahead while we,
okay. York County, let me just make sure I did York County project number 14. That was the equine support therapy with 66,792 spent, and that's recommended for approval. York County project number 15, that's the University of Pittsburgh Medical Center, York, addiction medicine with 114,000 or so spent and nothing additional committed, and that's recommended for approval. York County project number 16, Family First Health. This is psychiatric support, 36,900 spent, nothing additional committed, and we're recommending for approval. York project 17, Emergency Health Services Federation. This is an education program with 130,446 spent and nothing additional committed. We're recommending for approval. And last but not least, York County, project number 18. This is the Bureau of Health and Overdose Fatality Review Coordinator position with 30,782 spent and $80,408 committed. And that's recommended for approval as well.
thank you. Any questions concerning York County? Okay, we will move on to the resolutions. And there are 2 resolutions which I'll combine into one. First is resolved the Board of Trustees of the Trust, based on the recommendations of the working groups that met and reviewed the follow-up reports from the counties, hereby approves the following programs as compliant with the applicable settlement terms as set forth in Exhibit E, described and incorporated into the July 12th, 2022 order of the Commonwealth Court that created the trust. Venango County Program number 2, Wayne County Program Number 2, Wyoming County Program Number 2, York County Programs 13 to 18. And further resolved that the Board of Trustees of the Trust, based on the recommendations of the working group, hereby disapproves the following program as non-compliant with the applicable settlement terms as set forth in Exhibit E, Westmoreland County number 12. Can I have a motion to that effect, please?
Make motion.
Is there a second?
Second, this is Aaron.
Okay, any discussion? All those in favor, please say aye.
Aye.
Opposed? Any abstentions? Okay, thank you very much. I would note that there were some amendments and changes to these, but we will be posting all of these results on the website within a matter of days. I hope to have it up before Thanksgiving so that there will be the spreadsheet showing it as approved by the trust. And as I said, that will be up on the website as presented. We will now move on to the next agenda item, which is a resolution I know the counties will be very, very happy to hear. Pursuant to the order of the Commonwealth Court, it says the Board of Trustees shall distribute less the minimum amount that it holds in trust to maintain for administrative expenses on or about this year, the amount to be distributed from the county abatement and litigating subdivision accounts. On August the 28th, 2024, the Board of Trustees, consistent with that trust order, provided each participating subdivision a spreadsheet of the estimated distribution to be made to each county and litigating subdivision. The notice was subsequently recalculated and updated to include Wave 2 distributions pursuant to the approval of the Commonwealth Court of the amended trust order. A revised notice and spreadsheet were provided to all participating subdivisions on November 4th, since that was approved by the Commonwealth Court, and because of the fact that we had a special meeting that approved the Wave 2 expenditure. So we do need a resolution to make sure that we do fully authorize the payment of the money. And I would ask for the following resolution: resolve that based on the spreadsheet calculations prepared by the trust accountant, our Dussel, included in the materials distributed to members of the Board of Trustees for this meeting, the board hereby authorizes distribution of trust funds substantially similar thereto to the counties and litigating subdivisions identified therein, with such distributions to occur on or before December 15th, 2024, in accordance with paragraph Roman numeral 5D6 of the Commonwealth Court, the order of the Commonwealth Court entered on July 12th, 2022. Can I have a motion to that effect, please?
Moved, Kevin.
Postal.
Okay, been moved, and I accept Rob's as a second. Any discussion? All in favor of the resolution, please say aye.
Aye.
Opposed? Resolution passes. With that, I would like to point out for the record that this will mean that we are distributing to the counties pursuant to the Wave 2 settlements, the amount of, according to the Wave 2 settlements, $176,324,956. And pursuant to the Wave 1 settlements, $70,653,231. I would also say that previously paid under wave one in the first three payments under that, which were made in August and December of 2022 and December of 2023. There was the amount of $143,318 that was paid out, so that the total as of December 15th this year, the counties and litigating subdivisions will receive $390,035,505. So a substantial amount. And it is also a substantial amount to be spent over the next 18 months. I would note that of the $176 million number, a substantial part of that was the payment by Walmart that was a one-time only. It is going to be, they elected to make all of their payments in year one, so that whatever the Walmart portion of it is, the counties have 40 months to spend the money as opposed to the 18 months that is otherwise in the trust order. And once again, that is pursuant to the Commonwealth Trust Order, which was amended to reflect that they would have 40 months to pay that out. So are there any questions about, any questions?
I just want to make a comment that was decided by the board to push that out early, because otherwise we get sat on it and did out through over that 18 years, but the courts heard.
Attorney General was really doing
Hey,
the.
listen, I'm in the middle of an opioid trust fund meeting. Never mind. It's fixed.
Senator, you're not muted.
Sorry, guys.
No, that's quite okay. But the Attorney General's office performed all the administrative functions
Wait a minute.
and really did a lot of work for us. But we did recognize we were going to have to pass that on. It was logical to us, and this was beginning in 2023, that the counties and litigating subdivisions are getting so much of the money that was being distributed pursuant to these settlement agreements, that CCAP would be in the best position to really act as the administrative arm for us. And I can't tell you, they have just done a great job. I don't think any of us recognized at that time just how much administrative work was really going to be involved. Probably because we didn't recognize exactly how much the Attorney General was doing, but we didn't know how many meetings we were gonna have to have, the working groups. The presentations that they allowed us to make at their meetings. The amount of liaison that was gonna have to be done with the individual counties and additionally with council, with the accountants. The amount of work that was gonna have to be done in conjunction with administering and making sure all the compliance certificates are in that have to be given to the distributors pursuant to the settlement agreements, and indeed the certificates that were gonna have to be maintained in order for Wilmington Trust and M&T Bank to make the payments to the counties on a regular basis. So it has just been a tremendous amount of work. And CCAP has rightfully come back to us. Is Lisa available now?
She is, she's.
Okay.
she's on.
So CCAP wanted to give us what their proposal is for going forward. And they have one additional proposal they would like to make concerning how they can better serve the trust on an ongoing basis. So Lisa Schaefer is the director of CCAP and has been intimately involved with all of that. And I would like to ask her to make the CCAP presentation as to both the expenditures under the contract and also the additional liaison work that you would see that you would like to have added.
Certainly, and thank you for having me. We certainly do appreciate our relationship with the trust and the work that we've been doing to support it from an administrative standpoint. As you know, as we've been, kind of building the trust from its start, we've been learning more and more about the support that's needed. And I would also concur that Bree has been doing an excellent job in that role. Of course, over the last year, as we've added some of these additional meetings, some of these additional review meetings, that has increased the administrative work to support the trust quite a bit. And then we know that that is going to continue to expand. 2025 will be the first year with the 47 political subdivisions reporting. That's going to increase the reporting load. It's probably going to increase the number of public meetings because of additional reporting and appeals and things like that. So we would like to propose as part of the cost to support our services agreement for 2025 that we add a second full-time administrative position to support the trust. That position will help us to handle things like meeting logistics, data entry, tracking communications, and enable the current position, our director of administration, to free up her time to do other things like updating the website, developing better tracking and reporting processes, working with Penn State Extension, all of those things that really, have expanded beyond the role of a single individual. And we think at this point, adding a second full-time position to make sure the trust is fully and appropriately supported would be ideal. We are not proposing to change the scope of work under our services agreement, simply to add additional resources to fulfill those duties. Mr. Chairman, I don't know if you want me to talk about the liaison position right away, or if you wanted to address that issue first.
Well, is there any discussion just about the change in the scope of the work that is going to be undertaken? Personally, by the way, I just think it is so much needed. I can't tell you how much additional work has been involved, as I was saying. Plus you take into account the inflation that we've had since the time that we first considered this. All I can say is that CCAP has been a tremendous partner of ours. And each of the people that we've had working very closely with us, and certainly the work that Bree has been doing the last 6 months, and the things that she has undertaken, it would be impossible for us to perform the work and to have gotten $390 million out to the county on a timely basis and in compliance with all the provisions of Exhibit E without their invaluable help. So I think that the proposed addition is certainly justified, and I would like to ask you now to move on to the second part of your proposal, which includes the the creation of a new position that will be administered under CCAP.
Absolutely. So outside of the scope of our services agreement, as we've been watching the counties work to determine how they're going to use their opioid settlement funds, looking for ways to work with one another to better improve those connections with the trust. And as we've talked with some of our partners in other states, we would like to propose adding a contracted position to be supported by the trust. We're referring to as a county opioid liaison. So even though we at CCAP and with our affiliates certainly do work in these issues, it's become clear to us that it would be great to have somebody whose resources were devoted full time to helping counties work through these questions, helping them bridge gaps, work together, develop best practices and that sort of thing. So again, we are proposing a contracted position supported by the trust, who would serve as sort of that intermediary resource between counties and the trust, helping to convene maybe regional meetings where counties could better share ideas, providing a repository of successful projects that are happening, helping to provide better communication between counties and the trust back and forth. It's built on a model that has actually worked for us very well. We contract through grant money from PCCD. We support contract positions, the CJAB, the Criminal Justice Advisory Boards, who support the counties in that way. So we provide those contract positions that are funded by PCCD. It's a great model that we found that is very successful and our counties really appreciate. So that's why we're suggesting another contracted model here. If anything, we think we could probably envision this may being more of a short-term resource, maybe 2 or 3 years as this continues to get ramped up. Also, as those political subdivisions, as I mentioned, come online next year, and probably will also need that additional support and additional connection with the trust. So this is something we wanted to put, again, this is outside the scope of our services agreement. It would be a new sort of role and something we'd be looking to hopefully partner with the trust on.
Thank you. And by the way, if this is approved to have this position, we would make sure that we develop the full scope of work, exactly what the responsibilities would be of the county liaison. All of that would come back. The exact scope of that person's assignment would be fully vetted, and we would be able to have further discussions concerning that. But I do think it's important to get the approval so that they can go ahead and start working on exactly what that will be. I think this will be an invaluable add for us. I think that it's going to become even more important over the next couple of years to have a position where the liaison can help the counties interact with each other, share with each other the exact things that have worked, might not have worked. Worked with Penn State to further make it easier for the counties to report, but at the same time, give us all the information we need in order to be able to do our work. And it's so far beyond that which we, the tremendous work that we already expect of Bree, that I do think a new position is justified. As I said, we will come back with an exact description, but I would like to ask for the approval of the position in the resolution that I'm going to ask to be moved, and then we can have a discussion. The resolution I would seek is resolved that the opioid trust hereby approves the estimated cost for administrative services provided by the County Commissioners Association for 2025. By the way, that was included in all of your information that you received, and it would include the addition of a county liaison position. Could I have a motion to that effect, please?
I'll make the motion, Shay.
Thank you, Shay. Sir, a second.
I'll second it.
Thank you. And I would note that although the county commissioners that are also trustees, I would fully expect that they would be able to weigh in as to the advisability of this. They will be abstaining from the vote since they are both members of the County Commissioners Association, and they are providing service as trustees. So with the motion and the second, is there a discussion of the motion?
Thank you, Mr. Chairman. This is Postal, and yes, I will be abstaining from this. Just as part of the motion, I know that the proposal for the liaison, which I think is excellent from a county commissioner's perspective, it does go through the end of 2027, and then and so that would be for 3 years. So I don't know if you want to make it as part of the motion, that it will, proceed through the end of 2027 and then be reevaluated. I mean, I don't know, Lisa, what you want to do. I see it in your write-up here, and it was mentioned that it would be available, or this position is going to be available for 2 or 3 years. It does say the end of 2027, which I think is okay. I'm just asking for clarification.
Lisa, I'd like you to weigh in on it, but I would be willing to accept that modification to the resolution that we are approving the addition of the county liaison position for a period of 3 years till the end of 2027, at which time it can be reconsidered.
Yeah, again, we're anticipating this likely it would support counties and the political subdivisions for, again, a 2 or 3 year period through 2027. We're happy to have that conversation as far as what time frame you're initially comfortable with in terms of supporting, with the anticipation that should that support continue to be needed, we can have that conversation year over year or whenever the term would end, if that additional support would be needed.
The way I'm trying to phrase the motion is that we would be voting on it and approving it through 2027, at which time we would have a further discussion as to whether we wanted to continue it or expand it. But the person moving the
If I may weigh in, if I may still weigh in on this.
yes.
I just want to say this is this addition would be greatly appreciated. I know there's 3 county commissioners on this board, and we're asked constantly about the trust and what they think. We give them the commissioner's version of that and what we look for in our roles. And I know both Gene and Robert have done the same. I spent a lot of time traveling county to county to listen to opioid groups and advise them from a commissioner's point of view how to get the projects across the line and make sure they're compliant. So this, I think, is a great extension of that. I do think it's needed. I also believe that the symposiums went really well, and I'm hoping that will continue. I know personally, we're looking at all of the projects across the state as sort of a catalog for our county and seeing what works for us. So all of those library cataloging things that CCAP does so well, I fully do support. I didn't want it to look like I wasn't supporting it, but I can't be voting on it because I sit on the CCAP board. So thank you.
Okay, Shay, you were the person that made the motion, move the resolution. And I believe, Senator, you were the person that seconded it.
Yeah.
And you heard what my modification was, that this would be for a 3-year period of time through 2027, at which time we would reconsider the position with a view to either extending it, modifying it, enlarging it, whatever the case may be. But the resolution would be for the position would be through 2027. Are you willing to accept that amendment,
Yes.
Shay?
Yes.
Okay. Now, is there any further discussion of the motion? Hearing none, all in favor, please say aye.
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 Opposed? And would we please note the abstentions? Kevin, Rob, are you abstaining also?
Yes, I am. Thank you.
Okay, anybody else abstaining? Gene doesn't. He's not.
These members know.
Oh, right. Yes, Gina. Gina, I think has a.
Okay.
Am I correct, Gene? You are not on the phone? I'm correct. I know the way I phrased that was a little strange, but I will accept the fact that there's no answer to the fact you're not on the phone. Okay. With that, is there any new business to come before the group?
Future meetings.
I would note that we do have future meetings. We tried to put them fairly close to when we had them this year. But I would like for everybody to take a look at it, and if there is anything we overlooked, any important holidays that that we forgot about or didn't build into this, if there's any perhaps county meetings that would otherwise interfere to the
Tom,
members of the group, if there's any one of these, yes.
November 20th is a little difficult for me. Like today, I'm giving out turkeys. I'm not there. It's Thanksgiving time and I'm not doing what I need to do in the district so that I could come to this meeting. So if
Would
we
you-
could either make it a little bit before the 20th or further away from Thanksgiving, that would be wonderful.
Okay, why don't we, that's a very good note. And because the previous meeting will have been on the 21st, because we will have a reporting on the next September the 15th, but I do believe we'll be able to work have the working groups meet during the month of October. I think it would be fine to move up the November 20th date by at least a week to November 13th. How would that sound?
That works for me. I think that's why a number of the people weren't here today.
Okay, we will do that. We will move that meeting to the 13th. But my offer still stands if anybody in looking at their calendar sees anything else that arises. The other thing I'd like you to, all of the members of the trust to note, we are going to have I am planning and putting in the motion to try to have a retreat of trustees only, and or people that they have their representatives, so that we can, now that we have 2 years under our belt with acting as a trust, I expect that we will have at least one new member, maybe two, of the trust by the end of the year. Just given the elections and with legislative representatives, and it's an informational meeting retreat that I would like to have so that we can really discuss and make sure that we are all on the same page as far as looking at Exhibit E, that which we included to be in, and just have a very open discussion. I would like to also consider, and we're already looking at perhaps some outside speakers, perhaps those from out of the state, to see what the experiences of other states may have been in addressing these questions and how they may be trying to resolve some of it. So I would like to have, and going to schedule for sometime in January, an informational retreat. Bree and I are working out where it would be, and you know, selfishly, I would like to have it more in the center part of the state, but I also recognize that Harrisburg is probably the most convenient place, and particularly if for the legislative members. I would like to see people in person to the extent possible. I think it'll be very valuable for all of us to get together, see each other face to face. So we will get back to you with whatever date looks as if it works, and try to get as many of you involved as we possibly can. I think several people have suggested it, and I do think it's time for us to just kind of reconvene and make sure we're all on the same page with what we're trying to accomplish. So any questions about future meetings? Hearing none, motion to adjourn.
Before we do that, may
Yeah,
I have a
I'm
moment, please? First of all, I want to say this has been a tremendous learning experience for everybody. And I really want to thank the people that are on these, both the teams and both the trust. I think that, I know I underestimated the amount of time that we would be incorporated into this. So I know how valuable your time is. And so I appreciate what you're doing, whether it be on the leadership of work groups or TAG or DRC. Also Mark Dussel, Buchanan and Ingersoll on their work, and of course CCAP and Bree and Lisa and everybody on that side of the team. I can't say thank you enough. This has been truly a learning experience for everybody, including the counties, and the counties are the ones that have to do the majority of this work. And it's hard when you have to tell somebody no, but two things I wanted to make sure that people understand, both on the trust board and in the community, especially whenever things are being asked through social or through the media that we use. We can only deliver an opinion based on the information we're given. So as that information or facts change, while the opinion says, yes, this should be approvable, it should be allowable. As you add factors in there, it could change. And so I don't want people to wholeheartedly say that it's 100%. So when you turn in your information at the end of the day, it changes. Facts change. What's the percentage and how does it connect to OUD and all those things? I just want to put that on the record because I think that has been probably the most difficult part of being on this team, is giving people answers that are sort of not concrete, and that's been very hard. So with that being said, I also would just like to add that as we move through this next level of wave 2, the fact that they took the consideration into how it's expended out to the communities and we're taking on more role because now we're not only doing it for the counties, but all of the litigating groups as well. There's going to be some additional workload on CCAP, and I do appreciate folks approving that. And my only other housekeeping thing is I know that we've had a couple of trust board members that can't make these meetings for whatever reason, and and we want to address that because I think it's extremely important that we only have 13 trust board members. When you only have 13, you got to spread the work around. So I'm asking that we review and clean up if somebody needs to be excused or if we have to do something different. I think we need to address that. So I just wanted to put that on the record as well.
Thank you, Kevin.
Thank you.
Any other comments?
I'd like to wish everybody a happy holiday and a healthy new year.
I concur in that, and thank you all so much for your time. I can only echo what Kevin said about the appreciation for all of you putting in as much time as you have. I don't think that I don't know if I had appreciated back when I was asked by then General Shapiro to undertake this, whether or not how much time would really be involved with it. But I think it's been tremendously beneficial, and I would also like to thank all of the counties for all of the work they have put into this and the efforts, good faith efforts they have really made to comply. I think that the results of today's meeting, the number of programs that were approved, is directly related to the fact that they learned from things that they had heard, from recommendations that had been given to them, and really they supplied enough information for us to make some of the very difficult decisions we had to make. So I do really appreciate everything that the counties have done, and also all of the work that the Attorney General and also DDAP has made to help make all of our jobs easier. So thank you all very much, and have a happy holidays.